there is so much promise based on the science and based on the things that we've learned from the past, and we don't want to have to go through all the pain and suffering just when we know what to do.
Hey, I'm Kate, and this is Replay the Rewind, a podcast about the stories that built our world and people still rewriting it. We take a step back, hit rewind, and look closer. Each week, I talk with people who study history, the ones uncovering what really happened, and people who make it, the ones shaping what happens next. Because history isn't just what's behind us. It's in every decision, every trend, and every movement shaping today. So whether you're someone who loves history or someone who never thought you would, welcome. Hi everyone, welcome back to Replay the Rewind. It's Kate. Today I'm with a very, very special guest, Dr. Kurt Newman, who was the president and CEO of Children's National Hospital. Dr. Newman is a pediatric surgeon and healthcare leader whose work has extended beyond medicine into leadership and public service. During his time at Children's National, he led the hospital through major moments in healthcare, drawing on experience and perspective to guide difficult decisions. Today we'll talk about how history shapes leadership in medicine and what past public health challenges can teach us about the future. Dr. Newman, thank you so much for being here with me today. I'm so excited to get to talk to you. Let's just get right into it. You began your academic career studying history before moving into medicine and healthcare leadership. What originally drew you to history and what eventually led you toward medicine? Because I feel like they're very different topics of interest. So what was that? What marked that shift for you?
Well, thank you, Kate, and it's great to be here with you. I was very interested in history, politics. The things I liked to read were biography, actually, and I just love the stories of different leaders back through history, and then how that affected the politics of the time, the government of the time. So it was really this almost three dimensions that I was inspired by. So the biography, leadership part, then how that played into history, and then the public service and politics, how we could take that and make things better for society and people. So I went into college thinking that way and began taking courses. But it was also outside of college. There was a lot going on. There was Vietnam. There was lots of things going on the college campuses. And I sort of became, I guess, more and more disillusioned about taking this history and the stories and turning it into public policy and impacting society on a bigger scale. And so I became more and more interested in maybe the humanity. And then I had an opportunity to work in the hospital where I was going to college. And that just changed things, because then I saw, well, I can take things I've learned and some of it history, some of it science, but I really love taking that and applying it to people. And I saw that in the hospital, and I saw how the doctors and nurses were impacting people. So I just got inspired and focused on that. And I've never regretted it.
Was there a moment when you realized that history and medicine didn't have to be separate interests, but could actually inform each other or be connected in some way?
Well, the history of medicine is really full of stories because science builds on history in a way. So we learn more and more, and then we can learn some of the things we're doing wrong, or ideas that were just really, really wrong about what caused disease or what treatments worked or whatever. So in some sense, the history of medicine really becomes a history of a lot of the progress in society. And
Right.
so I love when I came across those stories. So it wasn't just, well, this is the way things are now, but wow, what a big change that a lot of times people take for granted.
Yeah. Were there some pivotal moments in history of medicine that most people didn't realize still affect healthcare today?
Well, I think there are a lot. I think people take a lot for granted
Yeah.
because, just think about surgery, for example. I mean, people just take anesthesia for granted, but it wasn't that long ago. It was in the 1800s, or people with diabetes take insulin for granted, and it's changed their lives. But that was back in the 1920s. Antibiotics have come along, transplantation. So
Yeah.
it sometimes it just feels like the things people are worried about are things we don't have answers to. Maybe cancer and a lot of genetic issues and all of that, but they take a lot of the medicine and the advances in medicine for granted. And that could be a problem because, people start questioning, well, because they don't really understand what things were like, but maybe before we had these treatments and things. So they're they don't realize what life was like when people were getting polio or even today measles. So they don't trust the science and stuff that we've built a lot of the progress on. And so
Right.
I think that's a big danger.
Yeah. I feel like the public is not really informed that much about like new advancements in healthcare. Like I feel like when I go on the news, it's mostly political. Like there's not a lot on the medical side. So I think that's something that can be a problem as well, is like not knowing that there are improvements in healthcare.
Your question at the heart of it is education and helping people understand and do it in different ways that breaks through all the noise that you know helps them see that we don't have a lot of the problems today that people had to face not that long ago. And
Yeah.
it and it's even happening today. There's areas in Washington D.C. where there's the infant mortality and maternal mortality are not what they should be for an advanced developed country like we are. So at some ways it's very frustrating. We know what to do, but we're just not doing it.
Yeah, that sounds really difficult, especially like in your position when you were a leader, like that must feel hard to handle.
Well, yes, because when you see the impact of people not appreciating the science and the advances and the progress and are going backwards, and knowing
Mhm.
that affects children's lives, for a long time, and it affects our society because kids aren't living to their full potential. It's hard, but it also is why being a leader and motivating people and trying to focus on those issues, and particularly when you're in Washington D.C., where you do have a lot of people that can make policy and make change. That can be very exciting.
Yeah. Yeah, it can be. How did historical thinking influence the way you approached leadership and long-term decision making? Did you use like any of your history knowledge?
Well, yeah, I mean, it's the one of the ways, and I think that was a value of having a background in history and liking to read and like reading and biography, and also seeing people's mistakes in the past, things that worked and didn't
Yeah.
work, was very valuable. So, for example, when the COVID pandemic was coming along, the initial reports that you'd hear was, oh, well, children aren't going to be affected because all we're seeing are adults with the disease. And that certainly was seen true in the very beginning, But knowing the history of medicine and pandemics and epidemics, almost every one of them has really impacted children. So we knew that this was going to eventually impact children. We didn't quite know how. So yes, maybe the respiratory disease and that the impact on adults was much greater initially. But think about some of the things we did see, the long COVID, which a lot of young people have been affected by, or the impact of not being in school and all the impact on mental and behavioral health that happened because of the pandemic. So knowing that inevitably children were going to be impacted and impacted in a big way, although maybe not exactly how yet, we had to prepare and we had to make sure that our teams stayed healthy and safe and we could get teachers back into the schools through immunizations and do all sorts of preparation and prevention to be sure that where we could, the impact on children would be less. If we hadn't known about the history of pandemics and epidemics and the impact on children, we wouldn't have known to take those kinds of precautions.
Yeah, especially seeing like the mistakes that were made in the past of like what to do and what not to do, and like how to treat. Because I think also like when you look back, you what you were saying, like you do see like the mistakes that people have made and like the terrible impact that past pandemics or epidemics have made. So
Yeah, and to your great point there is that okay, we need to learn from what we did right and wrong in this one, so that we are able to use that knowledge in history. And again, I'm afraid that people's attention span is short, and are we gonna,
especially
you know?
my generation specifically.
No, we're looking to your generation because I see a lot of idealism and I see a lot of positivity. But I think the perspective, though, is we need to study what works, what doesn't work, and pay attention to that, not just dismiss it out of hand because it happened in the past.
Yeah, I agree. Can you share an example where understanding the past helped guide a difficult leadership choice?
That's such an important question, and I think can think of a number of examples. The one that I'll focus on is it's been very difficult in a hospital when you're leading a hospital and you're making decisions not just for the individual patients, but you're making decisions for your workers, your doctors, your nurses, and all the people in the hospital, and you're making decisions for your community. An example of a really hard one, and this is recent, but also goes back in time, is to a decision to make immunizations, vaccines mandatory for the healthcare workers. So
Mhm.
you might say, well, everybody should have their own choice and they should decide for themselves whether they get immunized for something, whether it's the flu or whether it's hepatitis or whether it's COVID. But as you think about that, these people are working in the hospital and taking care of patients. And in my case, pediatric patients. So should those patients be at risk to be exposed by the healthcare workers? And should other healthcare workers be take a risk to be exposed by their coworkers? And then the impact if you have a big outbreak in your hospital and have to close things and now can't take care of the community. So that's hard because you might have some people that don't believe in vaccines. Each time that we had to face that, it was hard. But I think the collective decision and the leadership decision is to have the courage to do the right thing for the kids. That's how I looked at
Right.
it. And
Yeah.
so that meant to me, we need to have mandatory vaccinations. There were people that didn't like that. And even this latest one, as a step, I always wanted to be sure that I would do as a leader whatever it was that I expected the staff to do. I think that's what you have to do to help bring people along. You've got to celebrate their courage in doing that and the impact they have. But those are the kinds of tough decisions that I have to make.
Yeah, because I'm sure it's so hard to balance like what you truly believe is right and what you believe should be right for the hospital and all everybody else's opinion around you of what they think is right. So how do you balance all of that?
Well, implicit in your question is that there may be some people that disagree.
Yeah.
And, I always like to have a leadership team and get opinions from people that may have differing opinions. I always thought that was a great approach because you want to understand all the possibilities. If are disagreements as a leader, you have to make a decision. And when you do, the people on that team, once they leave the room, need to back that decision because they've given you your opinion, you've listened to it politely, and you've had discussions and disagreements maybe, but when you leave uh, you know the what's that thing about from Hamilton? You want to be in the room, but once you leave the room, everybody's got to be on the same team. So there's a
Yeah.
lesson, a lesson from history a little bit there.
Yeah.
But one of the books I always liked was a book about President Lincoln. He and his cabinet had a lot of the people that he had competed against to become president, and he wanted them in the room. He wanted to hear their opinions. So he appointed them to be secretaries of state and, war and everything. And he would listen to them. But it was a great way of finding the
Of
collaborating compromise, really brought the country together following this, or wanted to after the Civil War, by having that kind of approach. So that's, those are lessons you can learn from history about how great leaders, techniques, tactics, approaches that they used.
Yeah, it's a great example. Throughout history, public health crises have often exposed inequalities. How has studying past health crises shaped your understanding of healthcare access today? And you've already kind of touched on this, but if you want to expand.
Yes. Well, it's medicine's not doesn't operate, and health doesn't operate in a vacuum. So when you think about poverty or lack of education or hunger, food insecurity, all of those things, they're all intertwined with health and disease. And with children, it's clearly true. People, it wasn't that long ago, and it still happens that kids were living in housing where there was lead paint everywhere, and it really affected their brain development and their intelligence and that type of thing. And just not too long ago, that was happening in pipes and plumbing. And so we know how these things can impact health. And it's frustrating sometimes to see how little we spend or invest or take advantage of that knowledge. And I'm very worried, the impact of climate change on health that's happening, and it all of these things almost always impact children way more than adults.
I think that's a great point. Can you maybe expand on the fact that like climate change can affect health a little bit more?
Sure, it's not necessarily something that's obvious, but the changes that we're seeing throughout the environment and the impact of climate change on pieces of that, whether it's the weather and the the increasing temperatures, or the food supply that's being impacted, whether it's the water or particularly the air. The exacerbation that has on asthma, for example, is being studied. So these things are happening. They're almost invisible, which is part of the problem. We don't kind of aren't able to see it like a disease right away where you see people getting sick. These are chronic things that build up and impact kids because they're growing and developing, and a lot of these things that are happening in the environment impact them from the beginning, even when they're uh, in utero and the mother's pregnant. There's things going on that can impact. We need to study that and understand those impacts and what the causes are, and help people understand that we need to take action.
That's a great point of relating like big issues in the world to health because they all, I feel like, it, going back to your point, like they all connect back to health. And so, yeah, that's a really great point. How can historical awareness help healthcare leaders better serve vulnerable populations?
It's a critical question because just about every health crisis I've seen in my career, and this goes way back, I'm sure, is that it is the vulnerable populations, whether it's children or people with disabilities or people in poverty. They are almost differentially uh, impacted more by what goes on because they don't have access to the healthcare in many cases, or they already have some kind of chronic disease or weakness or something. And we've seen that in just about every health crisis, whether it was the most recent one with COVID, or whether it was HIV, just about any in infectious disease. We see it with asthma. We see it with diabetes. We see it with infant mortality. You can take just about any condition, and if you really look at it and analyze it, you'll see that those populations that are challenged, uh, there's more impact on it, and it makes so much more sense to try and prevent things than let them kind of get set up and then become like a chronic disease. And one of the biggest examples of that is mental health and behavioral health.
Yeah.
So if you could try and work on those things and diagnose those things early and help people, as opposed to then, they become homeless or whatever, or have chronic diseases, just the financial savings of doing doing that makes sense, not to mention the humanity side of it.
Yeah. Do you think there are like, if the solutions were easy, what solutions would you try to implement to help these vulnerable populations?
Well, I'd be very, very insistent and vocal about making the investments early. So early in childhood, or early in or during pregnancy, and make sure that that kids are healthy and have good food and prevention and get all of the services they need, whether it's hearing and speech or mental health or vaccinations, so that they can stay in school and they can live to their full potential. I think that's where the investments need to be, and that where the research. And actually, we spend much more money at the other end of life for
Yeah.
a lot of the diseases and chronic diseases and things that people are living with late in life and trying to extend their life. But we're really missing out on all the interventions that we could and should be making for children.
Yeah, that's a really great point. Do you think leaders today underestimate the value of history when navigating crises, or change, like especially going back to, like COVID and looking back on past pandemics and epidemics?
I think there is a big risk of that, and our leaders don't pay enough attention to or respect that. I do remember that there were presidents that every year would bring all the great historians together and talk about from the historical perspective, how they were seeing the world and what was happening in the world and the lessons that could be learned. I don't see that happening so much these days in terms of
Yeah.
medicine and bringing the great scientists and leaders together to come up with policies that are really grounded in science that can uh, help society move forward. And I think that's a big, big miss because there is so much promise based on the science and based on the things that we've learned from the past. And we don't want to have to go through all the pain and suffering just when we know what to do.
Yeah, that's very true. Shifting a little bit back to your job as CEO and your leadership role, history is ultimately about stories. How important was storytelling about patients, progress, or purpose in building culture within a hospital?
The lens and the perspective that I had coming in to being a CEO was through my care of patients and families in our community. So I would use those experiences and the stories that I had, whether it was in the operating room, in the emergency department, in the clinics, to highlight and make real things that might seem abstract. And so let's just talk about gun violence, for example, and the impact on children. Well, you can throw out a lot of statistics. There's lots of kids and families that are impacted by the gun violence. And I could tell you a lot of those statistics, but that wouldn't have the same impact as me telling you a story of um, a, a kid that I took care of that was shot. We had to get through that, but then he was angry and then he wanted to go out and shoot somebody. And there was just violence everywhere. And how are we going to deal with that? How are we going to change that? That makes it real for people. And so
Yeah.
it's not something that's, like abstract or happening somewhere that it's not impacting them, but it makes it real. And then you want to get people motivated to make change.
Yeah. So I feel like you're touching a lot on trying to be like relatable. Do you think that's one of the most important traits of being a leader? Or what would you say is like your top most important traits of having when being a leader?
Well, I certainly think it's one of the most important ones. Being relatable, there's two sides to it. One is understanding what people's needs are and what the problems are, and really taking the time to study it and learn. The other side of it is to then take what you've learned and being able to analyze and get people to help you figure out what the right approach is. Then you have to be decisive and
Yeah.
have a plan to move forward. And then you got to be able to sell that plan, and you've got to be authentic, and it's got to be interesting. You got to teach people, and you got to help and also bring them along to help you make change.
Yeah.
And then there's a side of it too. You need to be also humble. Like, you can make mistakes, and I need to be able to look at yourself and learn from your mistakes.
Yeah, those are really, really great traits. What advantages do students gain when they study not just humanities and the sciences, but like two different topics, you think?
I think having a broad education around and being a reader and learning a lot about not just things you've grown up with, but pushing yourself and learn about other cultures and learn about other religions and people. And you can do that through literature. You can do that through, studying through history. There's a lot of ways do that, and there's not one best way, but that then helps you have I think, an openness to new things, to different points of view that ultimately is really, really helpful. And no matter what you go into.
It's especially hard for me to figure out what I want to do too. Like I don't really know, and I think like college is kind of the most important time to try to figure that out in because you have more opportunities, but it's definitely really hard to figure it out in high school. So what you were saying, I think the broader education is really, really important.
And sometimes it's not even in college. I mean, it may, be even beyond that. And what you find is that an important part of education is mentorship and being mentored. And you certainly have some of that in high school. You probably have some teachers that just love and inspired you about different courses. But being open to being inspired by a mentor and learning from them. And sometimes that's how people make decisions. And that's been something that's been helpful to me along the way, is to have great mentors. But you have to be open to it. And so,
Yeah,
and some of the mentors I have, you know, have impacted me and been part of my life for a long time. And I've a number of times gone back to people and say, "What would you do in this situation?" And leadership can be lonely, and you have to be careful about that, not to get too isolated.
looking back on your career, how has your understanding of leadership evolved over time? Did you have like one idea of it first and then something shifted your view on it?
Being a leader is not really about yourself. It is about, in my view, making positive change for people. And I was learning to do, I was doing that in the hospital. I was working on different committees and projects, and I found that I liked it. I like seeing the change. So that was, I think, a spark behind it, was seeing the impact and making the change. For me, it was not about having the power and the authority for myself. It was more about having the ability to use that power and authority to make positive change for our hospital. And so that was the difference. So that may have been an aha moment for that. Like, okay, if you want to be CEO, you can't just raise your hand. I mean, you have to,
Right.
in a sense, go after it. But what are you going after and why? And you better have a good answer for that.
Right.
And so for me, the big answer was, I want to make this hospital better. I want to make it one of the best. I think I have some good ideas how to do it. And a lot of those ideas are grounded in having worked here for a long, long time and knowing what works and doesn't work. But it's not about me, uh, but it is about the hospital I care about and the kids I care about.
Yeah, I think that's what makes such a great leader, especially seeing like what you're saying is the fact that like you actually need to care about what you are leading and you need to know what you are leading. You can't just say, "Oh, I want to lead this because I want the power." So yeah, that's
Absolutely.
a really
I
great
think
point.
you said it better than I did.
No, I definitely didn't. Um, okay, on my final question, if you could rewind to any moment in history and watch it unfold, what would you choose and why?
So what struck me after watching the movie Oppenheimer a couple of years ago was the impact of the decision making that was going on, and how science really created this just awesome possibility of change, and harnessing nuclear energy. But on the other side, that people were trying to grapple with was the just unimaginable impact on it on if the bombs were ever used. So it was very interesting to me to think about that and what they were going through, and what would I do if I were asked to create an atom bomb,
Yeah,
knowing that it could be used and kill, hundreds of thousands of people or whatever.
Yeah.
And so I guess that's one point, but there's probably many others. That's just a real dramatic one.
No, that's a great point. I have to rewatch that movie. It's been so long, but I remember watching it. It was really, really good. Okay, well, thank you so much, Dr. Newman, for taking the time out of your schedule to talk to me today. It was truly such a pleasure to be able to sit down and hear your perspective.
Thank you, Kate.
Thanks for tuning in. I'm Kate, and this is Replay the Rewind. Every conversation, every perspective has the same goal: to understand how we got here and where we're headed next. See you next time.